Nothing. Well, we can now speak, fingers crossed, to Health and Social Affairs editor at the Sunday Express, Lucy Johnston. Lucy, yes, you are here now, I believe. Fantastic. OK, right. First and foremost, are we going to bring the army in? Is this a thing, or is it just the thing that people say when they're in crisis? Oh, can't get bread at Tesco's, bring the army in.
Well, I think there are contingency plans. It's not formalised yet, but we have done that before. During COVID, we brought the army in to deliver PPE and also to do testing at mobile COVID testing units. So it has happened before. The army obviously is trained in certain emergencies, but they're not going to have the range of skills, the diagnostic skills to understand sort of every patient's needs. So it is really quite a serious, there must be
right.
If these talks are happening, this is very, very serious.
Well, indeed. I mean, supposedly the demands that are being made by the Royal College of Nursing are around the 19.2% pay rise mark. The government, as far as we understand it, have said, well, if we were to give in for what you want, then it would cost us around 10 billion quid a year, and we haven't got that kind of cash at the moment. But can I live through the medium of you, please, Lucy? Because later on, I've got a member of the Health Select Committee coming on. And if you were trapped in a room with them, what kind of stuff would you be asking them? Because I'm keen to know, is the government really negotiating at all? There has to be a bit of give and take. And is it all the fact that nurses are being really unreasonable?
Well, you can look at it in two ways. It is an unfortunate time to be striking. We're going into winter. We have crippling waiting lists. We have an increase in respiratory viruses. We have patients, 25,000 of them, waiting on trolleys. And we have an emergency health service which is broken, effectively, and ambulances can't do their handovers. There's never a good time to go on strike, but this really has to be a very, very, we're going into winter. 19% is very high. And I think that the problems really in the health service, no one's really looking at wider issues. We've had 5 health secretaries over just 2 years, and no one's really grabbing hold of the serious underlying problems. The NHS does need to be looked at, needs to be reformed, and it's not going to function unless we can do some reforms.
Lucy, thank you very much. That was short and sweet, but that's the way it is sometimes. Lucy Johnston there, who is Health and Social Affairs editor at the Sunday Express. Controversial